Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. You are watching the Need to Know show. For today's episode, we're going to talk about heat and can you use heat and should you use heat after knee replacement surgery. So let's start first with the discussion of why you might be told that you shouldn't use heat or you can't use heat after knee replacement surgery, heat on your knee. So the argument is, and the thought process is that with heat, what it does is it can increase your blood flow, increase cell metabolism, and what that increased blood flow is going to do is going to increase the fluid that's coming into your knee, increase swelling, and increase inflammation, which is something that overall we might be trying to decrease, and so it's counterproductive to use heat on your knee. So a couple of thoughts on that is, first of all, whenever you use a heating device on or around your knee, it's typically giving you what we call superficial heat. So it's really heating the areas that are more on the outside. So the more superficial structures, your skin, your epidermis, your subdermal tissue a little bit, not too far deep into the actual knee joint. Some of those deeper tissues and the deeper parts of that joint might not necessarily get heated up and increase in temperature as much, and actually don't really. So that's one thing to keep in mind. Another thing to keep in mind is with inflammation, with swelling, inflammation and swelling is a normal part of your body's healing process. It brings healing cells, it brings immune system cells, it brings good things to the area that needs to be healed, such as your knee after surgery. So the thought process that you have to decrease inflammation as much as possible and limit inflammation as much as possible, that's not really the case. In the long-term thinking, that might be a little bit more prudent, makes sense. But in the short term, inflammation does serve a process to help your body heal and recover after an injury or something like a surgery, which you can think of in ways of an injury. It's a controlled injury, a controlled trauma to your body, but it is still the same thing, and the same processes are going to happen within your body. It doesn't know the difference between an injury that happens when you're running or something and surgical trauma. Your body doesn't really know the difference between those two. So those two things are worth considering. You also want to think about is you're not going to avoid heat for the rest of your life and heat and warm temperatures. At some point you're going to start taking warm showers. You're going to take, you might take some baths. You might go in a hot tub. Of course, after a couple of weeks, after the incision is healed and you're covered and you have clearance from your surgeon. And, the thought that you're increasing this inflammation, it's really not significantly doing that. And there's no hard evidence or research that supports that idea that putting heat and putting warmth in or around your knee or any type of surgery is going to delay the healing or increase the swelling substantially. It's kind of a theory that has some, it kind of makes sense some, but there's nothing really to support that theory or that thought process. So typically I love to use heat. I will use heat for a variety of reasons, but mainly I like to use it to warm up the muscles, to relax the muscles, to relax that sensation of tension, to give some pain relief to that area. And then typically I'll do some range of motion exercises or maybe some weight bearing strengthening exercises, and the person tends to tolerate it a little bit better. It's a transient improvement, meaning it only lasts for a little bit of time, but we like to take advantage of that window where the person might feel a little bit less stiff, feel a little more comfortable, have a little bit less pain and discomfort, and can tolerate some bending exercises, some straightening exercises, or maybe just some general therapy strengthening type of activities. I don't like people to be dependent on the heat. I like to get to the point where you're doing more of an active warm-up, something that builds kind of self-empowerment, self-efficacy. Doing the bike is great. Doing some just walking on maybe the treadmill or around the therapy room is great as well. But definitely use heat within the clinic. I think it's perfectly okay to use heat at home. Don't become dependent on it. Same thing with the ice. Typically in the acute phase, so that first, the day of surgery and the first probably week or so after surgery, I'm going to be a lot more focused on the ice just because there is so much inflammation and so much swelling in that acute phase. But then at some point I start to kind of use heat and ice, use them both for different purposes. So again, the heat more for the relaxation, the pain relief, improving comfort, oftentimes more before activity or like at the end of the day when you're relaxing and just trying to maybe go to bed or something. And then the ice more so maybe after a really intense exercise, maybe just when you do an activity and you have a lot of swelling and a lot of pain and discomfort. And also you want to play into just what you tolerate better and what you find more comfortable. If you don't really tolerate the ice very well and that doesn't really help you feel better and doesn't really do anything for the swelling, then you don't have to use it all the time. If you find the heat to be more beneficial, then you can use that a little bit more, and vice versa. Heat and ice are modalities and they're really a supplement to your recovery. So, the really important part is the physical activity, the physical exercise, the range of motion, the strengthening, the walking, the standing, all those things are probably much, much more important than, specifically using some routine for ice or some routine for heat. So use them as adjuncts and use them to help support your therapy. Just don't use them as the main key to your therapy, and don't get bogged down on the details, so to speak, either. They're more of a secondary thing, more of an adjacent to therapy, and not kind of something that we're overly concerned about, as long as you're using them appropriately and not, putting yourself at risk for any harm to your skin or anything like that. All right. This has been the Need to Know Show. I'm Dr. Luke Peterson. Shout out to Syracuse, Syracuse University, Syracuse basketball, Syracuse football, lacrosse. Close to where I grew up, so wearing the hat when I went for my run today. So there you go. All right, this has been the Need to Know Show, everyone. Take care, have a great rest of your day, and I'll talk to you tomorrow.